Okay, very welcome, Francois Martelet, CEO of Oasmia, to this interview at Erik Penser Bank.
Good afternoon, Klas.
Good afternoon. You reported your Q2 report today. Maybe you could start off, just briefly summarize the highlights during the quarter. Start there.
Okay, so a couple of things. I would say four major things for this quarter. The first is that we've made substantial progress with our partner regarding the commercialization of Apilia with Elevar. Two is that we have embarked on an improvement program with regard to XR 17, moving potentially to XR 18 and 19. And as well as make the preparation for docetaxel micellar phase 1b. The third important point is that we've been making some progress with regard to the IP protection of XR 17. And then I would say that we've been able to significantly strengthen the management and the senior team as well, with the appointment of the CFO, the Chief Business Officer, and a couple of high-level executives on the scientific side in order to further work and develop our technologies.
And when it comes to the organization, where do you stand today? Are you looking to recruit more personnel? And also, you have done this restructuring. When do you think this restructuring will be finalized and we see the full effect when it comes to the costs?
Yes, so Oasmia is, and especially at the end of the first quarter, where the transition of the resources would have been completely done to Elevar, Oasmia will be a company with around 30 people. And we don't intend to grow that part in the near future. We want to remain lean and mean organization. Of course, out of these 30 people, half of them are dedicated to our manufacturing and technologies operations. So I believe that we have the right size at the present time for the next 18 months or so.
Okay, great. I just want to jump to Apilia now. And a question about, you mentioned in the report a little bit about your launch in the Nordics, especially you have had your first sales in Finland, but also got some feedback in Denmark. Could you perhaps elaborate a little bit further about these two events?
Well, clearly, despite the COVID-19 situation, which is impacting all companies and the patients and the physicians as well, we've been able to record our first prescriptions in Finland, and we will obviously continue to follow up on this. Denmark is a more difficult case because we submitted an HTA, health technical assessment, that was not approved by the Danish authorities, and the reason is because we do not have any health economic data in the EU package that prevents us to get that. So that means that the prescriptions in Denmark will be fairly limited. Sweden, we still, let's say, experiencing significant lockdowns at the hospital level. It is still difficult to really, to detail our product. I'm sure you understand that, we have launched exactly at the start of the COVID-19. Therefore, it's obviously difficult for the physicians to have, physical interactions with us, not to been able to follow us on like they used to do. So it is more difficult. It will take more time.
Okay, I understand. And in Finland, is this just a hospital that has ordered Apelia, or is this more of on a national level?
No, it is a one hospital, and we do intend to follow through with these investigators. Yes.
And also your partner Elevar has partnered with Taiba in the Middle East, and I guess you're about to have a launch in Saudi Arabia. Maybe you can just briefly describe this market and why this is an attractive opportunity.
Yeah, I mean, clearly, the Taiba agreement is the first commercialization agreement that Elevar has signed off with a partner. So, given the fact that Saudi Arabia is the major country with a major potential in the Middle East, obviously this is the first target. We hope to get some more news from Taiba in Q1, Q2 of next year.
Okay, perfect. But you have some positive news out of Elevar, which recently updated the path forward in the US. And in my opinion, at least, confirming a very strong commitment to Apelia. What's your comment about their efforts?
Yes, so I know that some of our investors are a little bit disappointed by the fact that it will take more time to get an approval in the US, and this is correct. However, you need to view this very positively, because the study, that the phase 3 study that will be initiated during H1 next year will be a pivotal superiority study. So that means that down the road, we should be able to strengthen the labeling of in Europe as well, of Apelia. So therefore, opening up the floor to another categorization, potentially from a reimbursement perspective, opening up some pricing corridor potentially. So this is the way we should have a look at this. And yes, I'm very pleased, and I agree with you that this is a very strong commitment of Elevar with our of an indication in the US. Absolutely. So they will do it. Yes. And on top of it, I'm very pleased that they will be working with the GOG Foundation, Clinical Oncology Foundation, which is very well known in the US, very respected, and in particular with the FDA.
Mm-hmm. Okay, great. In your introduction, you mentioned the XR18 technology, I guess it is, not the platform, or maybe you could give us a little bit more information about the XR18.
Yes, so XR18, we have just embarked on that path, aiming at really making some technical improvements and secure long-term IP protection of the technology platform. So that will be a next generation of XR17. And, we all know that when it comes to technologies, we can always improve, like stability, like room storage, temperature. We know that XR17 is quite light sensitive, for instance, so we need to improve on that. So this is really the goal, and I'm pleased that our new hired scientist will be assisting us in developing that further.
And is this in an early stage still, or where do we stand?
Yeah, this is in early stage, but at least we have launched the project, and I do hope to be able to report during next year some of their findings and some of the improvements of XR17 transform, let's say, into XR18.
Okay, great. You also mentioned in your introduction about expanding the clinical pipeline, and What kind of preparations remain before dosing of the first patient for docetaxel micellar?
Yeah, good question, by the way. Excuse me. We are in a process to submit the clinical protocol to the design of it to the ethical committee of this institution. As soon as I have some positive result, I will communicate that to the market. But we are on track to initiate the study H1 next year.
Okay, perfect. You also, when you entered Oasmia and did your update early this summer, you mentioned that you wanted to do perhaps some sort of an M&A or licensing deal, in-licensing deals. How has that progressed, and what's the climate out there trying to do deals?
I think the climate is pretty hot. The question is more to find the right target, for the right acquisition, more than anything else. And of course, I could have acquired by now a couple of compounds or merge with another companies, and but it's important that we find the right target. And I have to say that we've been assisted by an external boutique firm on this, and we have been able to make some significant progress. And again, the strategic fit is my main concern. Is my main goal. We cannot acquire a cardiovascular compound, for instance. So that doesn't make any sense. When I see other companies acquiring compounds that do not fit from a strategic standpoint, I am quite amazed. So we are fairly close to be able to share some news, but I will leave that for the first quarter 21.
Okay. But just to follow up then, I mean, is the biggest challenge to find the right target, or is it also price competitive?
Yes, it's both actually. So the right target. So we have found, of course. I mean, we have done a couple of due diligence since I joined the company, and I'm quite proud because we done quite many. Now, it's always a combination of the criteria that you are using. So where do you want to go? So I am in favor of getting a product or a compound that has a positive POC, so a clinical POC. Otherwise, you are into the waters that are not really clear. The risk is even higher. So looking at those criteria, phase 1B positive in oncology. There are not that thousands of thousands. They are quite limited number. And then, of course, the partner wants to dance with us, and that's another matter. And then, of course, there is a financing piece as well. But above all, we are spending a lot of our time looking at opportunities from a scientific and medical perspective. I have a very strong team internally, I have to say that. Dr. Reinhard Koenig, based in the US, Dr. Nigel Goodman, based in Estonia. I mean, they are very, very competent. And the three of us, we are really making the best out of what we could look at.
Mm-hmm. And just looking a couple of years ahead, I mean, a main goal for you is to make Oasmia a cash flow positive company. When do you think that could be achieved? Is it in 2 or 3 years time frame? What could make your best guess?
Well, if you want me to commit to a particular year, that's a nice try. However, I would tell you that it all depends on the way we can get there. Okay, so the way I see it is a step-by-step approach. So that means get licensing in one compound, go to the next one, potentially do an M&A with a small company, in oncology, and step by step we can get there. But eventually, it's not easy. We all know that. Very few companies have reached that level. We all know that. But we have this ambition, and in this ambition, we are supported by our main shareholder, and the vision is really to become a specialty pharma company, mostly in oncology, down the road, cash profitable. Yes.
Mm-hmm. And then just looking like a year ahead, then what do you want to have achieved if we should have this talk like December 2021? What would you want to have done?
Okay, so first of all, some further progress and significant ones with the Elevar partnering, like a launch in Europe, launch in Latin America. 2, a successful initiation of the phase 1b, the Paxil micellar. 3, as you know, we are looking at partnering our animal health business and potentially as well XR17. So that will be an area in which I would expect to have some progress. Then, progress on our technologies as well in terms of development, XR18, 19. And of course, at least one licensing in compound, to say the least.
Okay.
Fairly ambitious.
Yeah. And you should have ambitious plans. I'm looking forward to follow this process during 2021. Thank you so much, Francois, for the call.
Thank you as well. Thank you very much.